Patients seeking buttock aesthetics primarily complain about their buttocks being small and flat. The primary issues we encounter in buttock aesthetics are having small and flat buttocks, buttocks that are too large or sagging. We shape our work around these three problems. The procedures we perform most frequently involve enhancing small and flat buttocks. Second are sagging issues, and third are reduction procedures for large buttocks and hips. Mainly, flat buttocks. And undefined buttocks come to me, there are two main solutions. The first is the classic fat injection or a stem cell enriched fat injection, or alternatively placing a silicone implant. Insertion. Usually, if the patient's examination findings are appropriate, meaning there is sufficient tissue in other body areas for liposuction, by utilizing materials harvested from their own bodies. I believe butt shaping and aesthetic procedures are healthier and more logical. Essentially, we are killing two birds with one stone here. Consider as an example in the hip, waist or abdominal area. Patients who have excess fat both get rid of that fat in that area, and at the same time the high quality portion of the fat taken from them is used. Their buttocks are made more defined and these individuals become much happier. Sagging in the buttocks usually occurs as a result of weight loss. If there is sagging in the buttocks, then we can clearly solve this problem with a buttock lift surgery. In the majority of these patients, those for whom we perform a buttock lift, we also see a decrease in the prominence of the buttocks. And since we also face the issue of flattening in the buttocks, we simultaneously apply fat injection to the buttock area for the purpose of enhancement. However, just imagine a patient whose buttocks are small and flat and maybe even sagging, but the patient is very thin, meaning there is no fat tissue to be taken from their body. Then the only option is a silicone implant. Just from the tailbone region towards the tailbone folds, by making a very small incision and inserting a silicone implant into the buttock naturally, while remaining within the limits of naturalness, we can perform buttock enhancement and lifting. Of course, when using a silicone implant, the patient needs to be a bit more careful for a few days compared to the fat injection technique. However, in any case, regardless of which technique we apply, that will be suitable for your body and will be natural and will also make you happy, we will achieve the result.